This is a discussion of the Synbiotic trial against sepsis among infants in India.
Sepsis is the result of the body's overreaction to infection. Your immune system turns on itself and stops fighting against the infection. Infants are at special risk for sepsis because they possess a weaker immune system. Sepsis can result in tissue damage, organ failure, and even death. It's one of the major causes of neonatal death, and around 70% of these cases are caused either by GBS or E. coli, which are the main pathogenics for this complication. In hopes of combating this, a few studies have been geared towards using probiotic bacteria to combat sepsis in infants. Probiotics are microorganisms, often referred to as the good bacteria, as they are widely known for their role in boosting the immune system. The use of probiotics is preferable to antibiotics, which lose efficacy over time. A randomized symbiotic trial to prevent sepsis among infants in rural India takes this approach in stride by testing sepsis against the synergistic effect of probiotics paired with prebiotics, which are non-digestible carbohydrates that serve as a food source for the probiotic microorganisms. This experiment addresses the downfalls of antibiotics in combating harmful bacteria due to antibiotic resistance. Antibiotic resistance is an example of evolution through natural selection in which antibiotics drive evolution by acting as a selective pressure on harmful bacteria. Antibiotics select for bacteria resistant to it by eliminating non-resistant bacteria. Over time, resistant bacteria become more common and antibiotics will become ineffective against the harmful bacteria. So, rather than employing the use of antibiotics in fighting sepsis, researchers have turned to probiotics. Use of probiotics proves effective because it doesn't have a selective pressure on harmful bacteria like antibiotics do. Probiotics are also capable of evolving since they are living bacteria. So that means it will adapt alongside the harmful bacteria and better combat it.
Although in the last decade, the death rate of children ages 5 or less has decreased 3.4% annually, the neonatal mortality has only dropped 2%. Premature sepsis is responsible for over 37% of these neonatal deaths. The problem is not only limited to developing nations, and even in the US, preterm infants or infants weighing less than 1,500 grams experience sepsis, raising the morbidity rate. The use of probiotic bacteria to prevent sepsis has been proposed, but only a few trials have focused on neonates, whose largely naive immune systems and less complex intestinal microbiomes should make colonization with probiotic strains more feasible. Therefore, the study was conducted to determine if the risk of sepsis decreased or the conditions, once taken root, could be ameliorated by the use of symbiotics.
Approximately 4,000 newborns were carefully assessed and then randomly assigned to either placebo or trial group. Each group was administered a capsule daily for their first week of life. The placebo group's capsule contained 250 milligrams of maltodextrin, while the trial group's capsule contained 100 milligrams of maltodextrin in addition to 150 milligrams of fructooligosaccharides. The dose given to the trial group was a synbiotic, meaning it combined probiotics and prebiotics. The infants were breastfed and burped prior to taking the capsule, and the dose was re-administered if the infant vomited. After the first week, the infants were then followed for 60 days. If any child showed symptoms of sepsis, they were immediately sent to the hospital to be taken care of and studied. Sick infants were placed into one of three categories: culture positive, culture negative, and left respiratory tract infection. Culture positive infants showed symptoms of sepsis, and when tested, their culture showed the presence of either a bacterial or fungal infection. Culture negative infants had the symptoms of sepsis, but their culture returned no indicative results. LTRI infants could have shown some symptoms for sepsis, but their culture was negative, and their symptoms aligned more strongly with those of a lower respiratory tract infection. Categorization in this way allowed researchers to better analyze the results and compare the placebo and group trials.
A total of 2,278 infants were placed under placebo treatment, while another 2,278 infants were placed under the symbiotic treatment. The vast majority of infants under the placebo and symbiotic treatments completed the study, 2,185 and 2,141 infants respectively. The primary outcome was the number of deaths in sepsis. In the control group, there were a total of 4 deaths and 202 cases of sepsis. In the symbiotic group, there were a total of 6 deaths and 117 cases of sepsis. The results showed that in the first 60 days of life, infants in the symbiotic group had about a 40% lower count of death in sepsis than the infants in the control group. These results are statistically significant because the data have a p-value of less than 0.001.
The symbiotic treatment was, according to Dr. Penigrai, surprisingly beneficial and efficient. Along with a decline by 42% of cases of sepsis and deaths, there was also an unexpected reduction of 20% in respiratory infection, something the study was not necessarily aiming for. In conclusion to the experiment, the benefit of using probiotics as combatants of sepsis is not only incredibly cheap, but also highly effective. This is promising, of course, but there still needs to be further experimentation on different samples and with different conditions. This study was, even so, a landmark in the process of lowering the effects of sepsis around the world.